today's webinar, Assessing High Opportunity Next Steps, Reconvening Leadership, Environmental Health, and Nutrition. This is our last webinar in our series for all three water tracks: public health leadership, environmental health, and nutrition and food systems. I'm Katie Mauman. I'm the Water Initiative Coordinator here at the Public Health Alliance of Southern California. And I'm running today's webinar with Holly Calhoun, our Food Systems Working Group Coordinator, and Tracy Delaney, our Executive Director. The Alliance is a collaborative of local health departments in Southern California, and we focus on multi-sector policy, systems, and environmental change to improve population health and equity. Just a quick housekeeping note before we get started. I want to encourage everybody to send in questions at any time throughout the hour. You can do that using the questions pane in your control panel. And we also really encourage you to ask questions verbally. So go ahead and just raise your hand using this hand icon if you'd like to share a question. We're going to have a little bit of time after our speakers to field questions, and we can call on you and unmute you then. So if you have joined the audio via computer, you'll need a microphone to speak into the audio, and if you join by telephone, you just need to be sure to have entered the audio pin on your control panel. So feel free to send a question anytime. And I just wanted to point out that we will be recording today's webinar and posting the slides and all the information on our website, so feel free to go ahead and share that information with any interested colleagues. Okay, and with that, I'm going to hand it over to Tracy Delaney, our Executive Director, to introduce our speakers in the webinar today. Tracy?
Great, thank you, Katie. And I want to thank everyone for joining us here for our final webinar in a series that's gone on over the last year. For us, it's been quite a journey, and we've learned a lot of very significant findings and areas of opportunity for us. We're pleased to have a wonderful agenda for you today for the final for our final webinar. Just a brief overview. We're going to start off hearing from the CDC and get their recommendations for local health departments on drought response. And we're also going to get a sneak preview on their new drought initiatives as well within the National Center for Environmental Health. After we hear from CDC and have a question and answer period, we're going to have a bit of hear some of the highlights from the 3 different webinar tracks that we had over the last year. And that's included leadership, environmental health, and nutrition. So we look forward to kind of hearing those highlights. And then we'd like to finish up sharing with you a tool that we've created based on some of the highlights that we've heard across these different webinars. So without any further ado, I'd like to introduce our speakers. I'm very pleased to have with us Rob Blake. He's an environmental health scientist and emergency coordinator at the Centers for Disease Control and Prevention. And among many of his accomplishments, one that we got connected with him is the way that he was able to coordinate the production of When Every Drop Counts, protecting public health during drought conditions. So we're pleased to have him here to talk about that. He's served in several posts over the 30 years of his career. He's been branch chief for the Environmental Health Services at CDC. He's also served as the health director in DeKalb County, Georgia, and also as the branch director for environmental health at the state of Georgia. He's also joined here with Colleen Martin. She's an epidemiologist from CDC, and she's currently the lead for the environmental epidemiology team. And she'll be talking to us about some of the new initiatives going on, at CDC. So Rob, thank you for joining us. I'm going to turn it over to you.
Thank you so much, and thank you for this opportunity to participate today. As has just been shared, I will briefly discuss the process of creating that public health drought document called When Every Drop Counts. Then I'll pass it across to Colleen Martin, a colleague here at the National Center for Environmental Health in the Environmental Hazards and Health Effects Division, for an update on their current drought activities. And we know that you're learning a lot of new angles from your experience with this intense drought that you're going through. So we've reserved some time in this webinar to hopefully gather your feedback, and that may be used to update the drought document and maybe create other tools and documents as well in the future. So the need for the guidance is the next slide. And I came to CDC after working in an Atlanta health department at the local level and then at the state of Georgia as the environmental health director. And one of the very first calls I took on my state job was from the Athens, Georgia area, which is the home of the University of Georgia. And the water utility was beginning to plan for prioritizing water users and for rationing of water just before the end of the year, and this was in the early fall. So that got our attention very quickly about getting involved. And at my own home, my well had run dry, and we learned as a family how important water is for daily needs. And it was a very expensive, deep replacement well to provide water in a few weeks later down the road. Howie Frumpkin was the National Center for Environmental Health Director at the time, climate change expert, and he asked us to develop guidance for health departments on dealing with drought from a health perspective, public health perspective. So we set about that task. I lined up some interns to begin collecting information on droughts to do an initial lit search. And then I started looking too for funding for the tool development process, and we were fortunate to and successful in landing some safe water funding. So I asked Martin Kalis in our Environmental Health Services branch to coordinate that task, and he did a tremendous job, as you will see. We were also involved with the CDC's continuity of operations planning, hence the slide picture there. That's part of our CDC Central Campus, and in the foreground is the surface water, which nearly dried up during that intense drought that we were in. And the surface water at the Central Campus plays a critical role in cooling of some pretty high-profile labs and test areas, so as well as IT facilities. So we were involved in the continuity of operations planning. I'm trying to advance the slide here. It's not advancing. There we go. So in the development process, with the funding, what we did is we launched a consultative forum process with many partners. We had a couple of lead-in conference calls, and then we brought the partners to Atlanta for a couple of days of pretty intense answering questions and gathering information, some of it verbal, but most of it, as you can see, they're all working and tapping away the information into their laptops. After that intense gathering of information from lots of different angles and lots of different organizations, we took that information as a leadership team, and then we had hired a writer-editor who then massaged all that information into a cohesive document. And from that, it's not responding very quickly. Here we go. Here's the front cover of the When Every Drop Counts, the document that was released. And really, as Dr. Frumpkin had requested, what we were trying to do is to get health departments, public health departments involved with the planning processes as well as the response to drought. And it's not necessarily an area that public health has done a lot of work in because there was very little literature that we were finding from a public health perspective when we started to create this document. The purpose, I'm going to whiz through these next few slides. The purpose of the document, as I just said, was to guide public health leaders and their staff in preparing and responding to the effects of the drought. It's not showing the advance button. There we go. I'm sorry, I need to go back one. Can someone help me, please? It's not responding very well at my end. Thank you. So what this document is not, we were not experts. This was a new area for us, so we were tapping into SMEs from around the country, so subject matter experts, sorry, and we knew that there were a lot of areas that still needed a lot of research to be, and a lot more review of publications following new droughts. So this slide is inserted just to say that we were not experts, and we're not intending by anyone reading this that they would become experts themselves. The next slide, please. We were very grateful to have partners from around the nation. We had folks from the National Integrated Drought Information System, NIDIS, others from the National Drought Mitigation Center, and other organizations across the public health spectrum. And their data, their maps, the subject matter experts were integral in the creation of this document. For the next few slides, we have, Katie recommended that I take those out as far as the health aspects because you've previously covered these in other webinars. But what she did ask me to do in these next two slides is to connect you to leaders around the nation who've worked on the drought area, and then I took it to the next step and asked them to contribute on these slides, these next two slides. The first person I spoke to was Scott Holmes from the Lincoln-Lancaster Health Department in Nebraska. Scott's one of the leaders in environmental health in this nation. He's very prominent in the NATURE, the National Association of County and City Health Officials organization. And he's recently begun collaborative work with the National Drought Mitigation Center at the University of Nebraska-Lincoln, Scott's home city. That led to a connection with Nicole Wall, who's the collaboration and outreach coordinator at the National Drought Mitigation Center. And they have a work group underway with public health aspects, and they would love to have someone from the California region to represent your needs in that group. So I put that out there to your organization. Maybe someone would like to jump at that opportunity. Scott commented on these slides, it should have fewer bullets, and I agreed. I said, but these are the previously cleared slides, and that we were, because of the timing of this webinar, I was not able to get new slides back through our CDC clearance process. He particularly said that the vulnerability assessment slides and the strategy bullets could be combined. But basically, his statement was that the Lincoln-Lancaster Health Department was just beginning their drought response work. The next person on this slide that I've wrapped in was Dr. Betsy Kagi. She's a toxicologist, works at the Emergency Preparedness Section, Georgia Public Health. And I worked with her when I was at the State Health Department. She created, with the help of many others, a Georgia Public Health Drought Guidance in 2007. And the several areas that she brought out as high points for her work was that she became involved with the Southeast Kidney Council about dialysis patients facing changes in water quantity and water quality, and particularly those not associated or connected to a healthcare institution. She also became involved with economically disadvantaged people, particularly farmers that were losing their businesses, migrant workers who were coming to work on the lands and they had less income because of smaller crop sizes. And Betsy also looked at power outages, as less water meant that some power stations went offline, and there were some particularly blackout and brownouts in North Carolina and North Georgia. If you could move to the next slide, please. So in this, we're in a response in late stage and severe drought conditions. I talked to Tom Gonzalez. Sorry if I had a wrong key there. The next person I talked to was Tom Gonzalez. He's the Environmental Health Director for El Paso County in Colorado Springs, Colorado. And we were both on the National Environmental Health Association board together, and he's prominent in that organization. So he would be another, I think, very good connection for you. They went through intense drought accompanied with wildfires, which actually got so close to their offices they were forced to relocate the environmental health offices. And as I talked to him and looked at some of the documents, they looked at a lot of things as far as shelter, accommodations, food, water, air quality, the provision of N95 masks to the community, cleanup, and he was very thankful. He put a plug in for our environmental health training and emergency response, EDA as we shorten it, at the FEMA Anniston, Alabama facility. That is an introductory awareness level course, and Marcy Barnett in California has put that on the road for California environmental health practitioners. We are about to launch an operational level hands-on course, so that might be something that California environmental health folks will be looking for at the FEMA facility. Tom went on, though, to say that it didn't just end with the wildfires, that then came flooding as the rainfall came back, and it ran off the hardened, almost concrete-like blackened soil, and shelters had to be reopened, water wells and on-site wastewater systems failed or were destroyed as heavy equipment and mudslides caused a lot of damage to the underground infrastructure. They also had a lot to do with household hazardous waste collections, and there were breaches in the water systems, and new arrangements had to be made with their landfills. Just bring that all up just with El Nino being so much in the news right now that I know you've been down that road before with mudslides and the damage that heavy rains can bring, but after intense drought, it could be much worse. And finally, the last person I connected to was Kathy Dolan at ASTO, the Association of State and Territorial Health Officials. She helps head up an environmental health directors group and leads a water subgroup of the directors. And in one of her communications, I didn't actually get to speak to her on the phone before this webinar, but one of her communications, it was about the New Mexico situation where the state has given $100,000 to the University of New Mexico State University, and the New Mexico Institute of Mining and Technology to figure out how drought affects rivers, reservoirs, groundwater, etc. But unfortunately, as I looked at it, it didn't appear that there was the working group had a health department representative, and it also looks like the money has dried up for that group. So again, it might be an area or a region of the country field group to reach out to. Next slide, please. So the last slide that I'll talk on is we knew as we developed this document that there were a lot of research areas and initiatives that probably needed to be started and looked at for future droughts. These were a few that were listed. And as I'm monitoring and watching your situation from afar, it's really interesting too to see all the policy changes and discussions that are going on in your state. So such things as the water recycling, desalination plants, the planned new plants for California, less water being used, but that affects utilities revenues, and therefore they're going to have to charge more for water. The public shaming of the high users, it's very interesting to watch. The less water being used, creating sewer backups and corrosion and grease buildups in sewers. And then the differences between the north of the state and the south of the state, the agricultural users against the urban users, some crops demanding more irrigation, and even the treated fracking wastewater being used for irrigation was very interesting. The damaged foundation and wells, levees getting cracks, and then El Nino, I guess, they're looking at underground storage and how to capture that rainfall when it does come and the snow melts. So lots of things going on in your state. That's why we'd love to hear from you about the public health aspects. And it was really an opportunity once Katie asked me to participate in this webinar. As I reached out into CDC for the update since we did this document, which was a few years ago, we found out that our sister division, the National Center for Environmental Health Division of Environmental Hazards and Health Effects, had recently been awarded emergency preparedness funding for drought-related work. So it was a great opportunity to connect with Colleen Martin about their work and research areas and the connection to the climate change work that's been going on for a few years. So with that, I think I'll pass it across to Colleen, and then we'll take questions together afterwards.
Great, thank you so much, Rob. My name is Colleen Martin. I am with the Health Studies branch at the National Center for Environmental Health, and I appreciate the invitation to speak with you all today. I'm just going to take a couple of minutes. I don't have any slides or anything, but wanted to give a very brief overview of some of our areas of focus with regards to drought. And also wanted to add that our partner program in our division is a climate and health program, and we do work very closely with them on this work. So drought, the public health impacts of drought is a priority for the National Center for Environmental Health. We have several kind of planned areas of focus. At this point, all of them are pending funding, but we do have some areas of focus, and we want to present those to you, and then definitely want to get your thoughts on them, and are seeking collaboration going forward. The first planned area of focus is looking at the health effects of drought. It seems that there's a knowledge gap or a data gap in that area. There are a lot of questions about kind of what are the actual health effects associated with drought, what are people experiencing that, with regards to that, and so that's an area of interest for us. The second planned area of focus involves developing a drought resource guide for state, local, territorial, and tribal health departments that can help with planning and response to drought. And again, pending funding, we hope to build an online tool as well that will provide information to folks on the location and severity of drought, location and estimated size, when available, of populations that may be most vulnerable to drought. In other words, populations that are most likely to suffer health effects from the conditions created by drought, in one easy-to-use location. So kind of bring together different information sources and make those available through an online tool. And with this particular project, what we're hoping to do, or what the steps are, is to first conduct a literature review. We'll take a look at drought-related research and initiatives, look at the latest information on drought and public health since the publication of the CDC's Every Drop Counts, set up a work group of internal and external subject matter experts to kind of inform what the most current needs and concerns are with regards to planning and response to drought. We'd like to conduct an assessment of state, local, tribal, territorial health departments regarding their awareness of existing drought guidance, get some input from them on what they'd like to see in the planned online drought tool, and kind of get some more information from them on what seems to be working, what are best practices with regards to responding to drought, lessons learned, what are the gaps with regards to preparedness and response, and all to inform the development of this guide that kind of builds upon the When Every Drop Counts document, and also will be used to inform the tool that we discussed. And as far as data sources for the tool, it will build upon some existing data sources, one being an existing social vulnerability index tool that exists at our partner agency, Agency for Toxic Substances and Disease Registry, and then also building upon information or including information from the National Mitigation Center's drought monitor.
Because I'm on in a few minutes. Okay.
So that provides kind of a very brief overview of some of our planned activities, again, pending funding, but again, we'd be very interested in getting some of your feedback and thoughts, and then also, I don't know if it's appropriate to provide it now or later, but I can also provide my contact information, my email and phone number, if anyone wants to speak further about it after this webinar.
Great. Thank you so much, Colleen. That was really great, and it would be nice if we could share your contact info. And we're going to just move into to see if there are any questions here for either of our speakers before we move on into recapping our webinar series. So please go ahead and raise your hand by clicking this hand button, or feel free to enter in questions here. So please go ahead and do that. And then I would just also just thank you both, Rob and Colleen, for what you shared. And Rob, it sounds like there are some really interesting pieces of work happening around the country in connection with the report and some of the follow-up. And it would be great if we could share some of those names and departments and initiatives with our participants on the call today. We'll be sending a follow-up email, and so I'd love to speak with you after to be able to share some of those. So hopefully everyone can keep an eye open for that. And we'll also be providing a link to Every Drop Counts, the report that Rob Blake spoke about. And it would be wonderful and exciting to follow up and see how we can collaborate and contribute to the update that's happening and some of the work, Colleen, that you're doing at the National Center for Environmental Health. So looking forward to continuing that conversation. And I'm not seeing any questions here, so why don't we go ahead and move on. We'll just hear just a brief recaps of some highlights from our 3 webinar tracks on water. So let's start with Larry Fay, who's Director of Environmental Health in Santa Barbara County. Larry, if you want to go ahead and unmute yourself, that would be great.
Yeah, I'm unmuted now.
Great, thank you. And so we've invited Larry to share some highlights from the Environmental Health series. He's been a great collaborator with us on that.
Well, Katie, you asked me to address kind of 3 questions here. And the first one being, what was my one big takeaway from this whole environmental health series? And I think the thing that struck me the most through this whole water series was the one factoid that came out early on. I think Angelo brought it up, that we consume about 40% of our energy, at least in the southern part of this state, moving water around. And that speaks to both just how important water is to us, that we're willing to dedicate that level of resource to moving it. It also points to just how irrational the system is. And then as we talk about drought and some of the drought mitigation and move into things like desalination, it kind of goes back to the whole thought that there's always more water out there if we just want to engineer it and pay for it. You know, it doesn't make a lot of sense to commit more, as we're talking about climate change, greenhouse gases, you know, that our first reaction will be to develop another water source that is even more energy intensive than what we're already doing, that's producing water at the low end of the system that will have to be pumped back up to the end users. So I don't know. I don't know. To me, that just the big picture irrationality of our water system here, and the idea that there's always more, we just have to go find it. Kind of key takeaways, I think, from an environmental perspective is we, as a profession, we have some very important, very critical roles in a regulatory world, but I think so often we get focused in the rules and regulations and the minutia that we tend to miss a big picture. And for us, I think a challenge is to instill systems thinking across the board amongst all of our staff, you know, with our leadership in particular. We're seeing a lot of that, begin to move that across the profession, so that when we are looking at these challenges, we are also able to meet the challenges with kind of creative, innovative thinking that can afford or can provide basic public health protection at the same time help address the issue. I just give one little example here locally is we have a restaurant in Lompoc that put in an air compressor system to rinse or pre-rinse their plates instead of using rinsed water, and we had some questions about that and had a look at it, and it seemed like a pretty effective system, but I can imagine the first thing that would come up is the equipment is not NSF listed, therefore we can't put it in there, and if we're stuck in that kind of paradigm, you can't make any sort of changes because there's no NSF listing for a product that's not in use. So anyway, and I think as we talk about next steps and opportunity, for me a big one is this continuing collaboration and dialogue that we're having across the system, whether it's food systems and local production, our active living and healthy communities and healthy environments and active living programs, environmental health roles, and those, just understanding the linkages between our natural systems and public health so that we can begin to remodel or rebuild our cities into more healthful environments that will reduce the chronic conditions. We just have a whole array and future to look forward to if we will embrace that is part of our mission as environmental public health practitioners. And I think those are just some good off-the-cuff thoughts.
That's wonderful. Thanks so much, Larry. Let's go ahead and move on to Gayle Hawkster in Riverside County, who's going to share some recaps from the nutrition series. Gayle?
Thank you, everyone. It's been a great year with some great sessions. And with that, the first question as to what are my takeaways from this is, you know, as I look at it, in our track, nutrition and healthy food access, water is really a common thread. And so we couldn't do without water. And I think in our work group, it's really definitely an integrated issue. And one of the things we looked at is there's a lot going on when you take collaboration with the ag partners and the food industry and the food educators and everything working together, really looking at how do we produce food with less water. And with that, we're seeing some methods came across in our sessions, such as aquaponics, hydroponics, where they're growing in the soil in the Farmers in the ag industry are working with measuring how much water is really needed to grow the food. The one example was the avocados being grown on a new avenue called a 10 by 10. So I think we saw a lot of different innovative and ways that people are now water conscious. The drought, the good thing out of it is it has really brought water conscious and looking at how we work and also at the consumer as well. And a takeaway that I have from the series, or I think that all of us have, is really innovation on growing food. And how do we do it? And from the community garden to the individual garden to the large-scale ag. And I'm glad water has been at the table this last year. And what are the recommendations for next steps? I think one of the things I'm really glad to say that one of the things we had was Rethink Your Drink. I think that is going on in many different areas, from hydration stations, access to healthy drinking water in schools, in parks. Thinking in many of the programs and the grants out there are educating consumers on Rethink Your Drink. And I think water will never be the same. It's the new beverage, and I think that came out clear in our sessions. And I think from procurement standpoints, farm to fork, supporting local agriculture, sustaining growers through purchasing. There's just really a lot of opportunities, as well as collaborations for table for water use discussions. Working with I know in our county, one of our partners or champions is the Water District, and they are helping to write grants and get dollars for school gardens, also putting in hydration stations. So I think you're going to see water is a common thread that is bringing a lot of partners and collaboratives together. And with that, I want to say I'm excited about the checklist that is going to be regarding nutrition and the NEOP work, and looking at how what we can do over the next year with water being a common thread, or the golden thread. And I think that's it.
Great. Gayle, thank you so much. And this is Tracy Delaney. And unfortunately, our chairs were in the midst of an accreditation visit. So I'm going to pitch it for them on some observations for the leadership track. And I think one of the most memorable facts or issues that came up had to do with the state of emergency in Tulare County. And so when we heard that presentation, to me it was pretty shocking to find out that over 1,500 wells have already gone dry, and that 55% of all the well failures were statewide were in that county. I think something that was the most memorable regarding that, and somebody, can you put yourself on mute for a second? I'm hearing some background noise. I think one of the most striking parts of that particular webinar was the fact that people were fearful of reporting that the wells were going dry, that they were worried that their children would be taken away, that they wouldn't be providing a safe environment, and that there were fears of deportation. And so to me, that really put a lot of red flags and opportunities for us to really look at how do we connect across all of the different departments within local health departments, and really think about our primary target population, which is disadvantaged and vulnerable communities. I think that there's ways that we could probably be cross-connecting the work that we're doing in various departments to help with outreach, to help with education. And so that one really struck home for me. When I was presenting some of this information to the CHEAC, the Health Executives Annual Conference, they were very aware of many different kinds of health effects regarding droughts, and this was just something I made a note of when Rob was talking. And they were really concerned with a lot of the mental health issues related to drought, and I think that that's something that we really need to consider and look at more closely. As far as some of the takeaways from the series, I think when we were first starting this, many of our health departments knew that the drought was something that was very important, but that we hadn't really been working in that space. And I think that as this series went on, we started to really identify that there were a lot of connections within multiple departments that touched water, and that there was an opportunity for us to think about that beyond just emergency preparedness, but really to incorporate it within the operations of multiple types of departments, so that we were creating much more adaptation plans regarding drought. That kind of, Gayle did a nice job talking about things related to food systems. I think there's a lot of land use that we could be looking at, putting in a water and climate lens. So as far as recommended next step, we've been having some great partnerships with the environmental health directors, and I think that there's a real opportunity for us to advance some of this work more cohesively and in a more integrated fashion. I think that there's also a chance for health departments to take it on in terms of building up their own internal and external capacity in ways that maybe we haven't done so far. So I'd like to take a break. Maybe I can turn it over to you for a second, Holly. Maybe we can open it up before we talk about a tool that we've tried to create of capturing some of this information. And maybe we can just open it up to get any other comments for people that have participated on the series, or any recommendations or particularly memorable areas or future areas of opportunity. So Holly, can I turn that over to you, since Katie's having a little reverberation there?
Sure. And this is Holly. Katie, I think your audio might be fixed now if you do want to try to jump back in here. But if folks want to go ahead and use the raise hand feature or send us a message through the question box, we'd be happy to take you off of mute or verbalize your comments if you prefer to type them in. And I'm not seeing any questions come through, nor any hands raised.
Don't be shy out there.
I'd also be curious to hear, Rob, Blake, I'm not sure if you're still on the line with us, but just in hearing a little reflection from some of the issues that have come up in California, you know, your sense of how those connect with some of the actions and issues that are raised in the publication Every Drop Counts.
Yes, thank you. I'm still on the line. So some of those areas I think Colleen was getting at, as far as the health effects and surveillance data analysis improvement, but some of these whole new areas as far as wastewater recycling, the so-called toilet to tap kind of approach, you know, that's being looked at. I think the spray irrigation versus drip irrigation is a whole, you know, new area. I think with your state, there's been so much history of water rights too, and the differences between the north and the south, and then the agricultural and the urban areas is just huge. So we're watching very closely because, you know, this is going to happen in other regions, but your part of the nation is going to have this again, you know, as climate change continues. So we really appreciate this opportunity. We were hoping we were going to hear from some public health folks out there on the front lines, but don't be shy about sharing now or later through to Colleen and myself, and we will certainly try and include you. And everyone that I did mention, as far as other parts of the country where they're working on this, all of them were willing to be resources for you if you want to reach out to them and to you know, consider the different aspects that they were dealing with that were particular for their region or their area of the country. But thank you for the opportunity today.
Mm-hmm. Thanks for being with us. All right, well, in the absence of other questions, Tracy, do you want to take it away with our tool?
Sure, I'll give it a shot here. I'm not sure if there's a way you're going to hand it over to me so you can see my screen.
You should be able to click on a prompt now, Tracy.
I see, show my screen. Okay, cool. Is it working?
Yep.
Okay, so this reminds me a little bit. I had recently seen a documentary on Walt Disney, and it was talking about when they were first opening up Disneyland, that into the night before the opening, they were still painting and doing all kinds of adjustments to Disneyland for the grand opening. And that's a little bit what's happened to us in developing this tool that we want to share with you. So it's kind of our maiden launch of this tool, and so we're really open to suggestions and recommendations. But what we tried to do is gather all of the different information that we had heard from the different webinar tracks, and to try to think about it in terms of how would a health department start incorporating this within existing operations. So if you go to our website and you click on, so that's what you see here, if you click on the Water Crisis and Health and go down to Water Action Checklist, that will pull you into this series of checklists that we've developed. And so, again, trying to just think about harvesting the different information and how would we do that. So what we found is that there were some very direct correlations, and those specifically worked for the 3 tracks that we had sponsored, the first one being the public health leadership. So if you click onto that, we tried to put together just some simple checklists if you wanted to go back to your health department and maybe bring this into a meeting or start actually operationalizing this. And one of the kind of basic areas that we saw for leadership was to provide that leadership of connecting staff. And we found that there were many different departments that were actually working within water, and they may not be thinking about the fact that they're working in water or that they can connect with other departments that are working in water. So we tried to collect that information. We created some resources here. You can see the CDC, when every drop counts is listed here. The idea of maybe creating a water ambassador that could serve as an internal lead, and to just start cross-connecting people so that you could start building up that internal capacity. We also thought there were a lot of opportunities, and we know that currently when we spoke with our members, a lot weren't really engaged in terms of external capacity building. And so here was some just ideas that we had put together. We also wanted to make sure that you had an easy kind of place to go to find vulnerability studies that had already been conducted by water agencies, and to think about that, and to maybe partner with them and put a health overlay onto these assessments. We also know that here in California, we have a tremendous amount of new funding opportunities and resources. So again, we tried to collect that information in a way that you would be able to access that, read up on it, and hopefully provide some resources for your local needs, and maybe partnering with other external partners that might be the lead, or perhaps the health department could be the lead. I'm not going to go over all of these, but just to give you kind of a sense of what we were looking at here. Environmental health really is just a real pivotal, I think, sector to be working on this. We tried to put together things that could be done internally in terms of looking at internal regulatory frameworks, and to offer up some of the best practices that surface through the webinar series that we've done. This isn't a comprehensive part of it, it's just kind of beginning to collect that information. Another one would be, what are some things that environmental health could be doing, partnering with external collaborations and looking at different types of best practice model ordinances and different frameworks. And so we've tried to collect that here. So hopefully these things will be of use. A lot of these were taken from our speakers in the series, and they've generously provided these resources for us so that we could collect them for you. And we also see a role in terms of environmental health to really get involved with that emergency preparedness piece and with water vulnerability assessments. It seems to us that a lot of the potential guidelines and regulatory frameworks could actually be used as part of adaptation plans and more upstream approaches to emergency preparedness. So we'd like to kind of think about that in a more comprehensive way. Let's see. Take a little look here for nutrition. Gayle had mentioned some of that. These seem like real opportunities for health departments and NEOP programs to be looking at water-friendly types of policies. That could happen both in procurement and with some of the food services. And so we've collected that. Some of the information and educational pieces around and diet are also collected here. I think that one of the other issues that really has come up is water pricing, and I think that being able to think about water pricing maybe with a different use when it comes to water that's being used for edible purposes versus just landscape purposes is something that we probably need to tease out a little bit more in terms of our own state policy. So anyway, these give you some ideas. I guess one that I'll just kind of jump in because it's one of my favorite areas is around healthy communities and built environment. And I think that over the last probably 5-6 years, a lot of our health departments have really moved into much more of a land use as a way of building in healthy communities and resilience. And we really found that there were a lot of opportunities to take that existing work that's happening right now with land use and transportation and to go ahead and build in design standards, recommendations that could be really building up water resilience within that practice. And so we're actually in the process of trying to develop a water design guideline so that people, health departments can go and build that in as they're reviewing plans in various city and regional land use planning. So that's a highlight, I think, of some of the work and the directions that we're hoping to go in. Katie, did you have any other questions here?
There are no other questions from the audience, so just give everybody one last opportunity to share any comments or questions. And Rob or Colleen, if you'd like to add anything, you're welcome as well. I think we have a question here. Let's take a look. It's a comment that the tool is what a great tool, says the comment. So thanks for that nice feedback.
Did that come from Carla Blackmar?
No, that didn't. That came from Linda Helen. So thank you, Linda.
Thank you. And like I said, we just have kind of put this together, so we're really open to your feedback and to your recommendations as to how we can continue to improve it. But thank you. Great. Anything else that you see on the horizon there, or shall I do a little bit of a wrap-up here?
I think we can go ahead and move to wrap-up. Thank you.
Thank you. Well, I want to thank our speakers, Rob and Colleen. I'm really hopeful that after this conversation that we can regroup with you and maybe explore a little bit further some of these partnerships as you guys are moving forward and we're still kind of trying to take our work to the next level. I'd like to also thank the people that have helped support us throughout this entire webinar series over the last year. There's been a lot of people that have helped us out, the first and foremost being our Leadership Council. They gave us a lot of direction as to what would be useful for them, so we hope we hit the mark on that. I'd like to do a shout out to our leadership chairs, which are Susan Harrington of Riverside and Cheryl Barrett from Long Beach. They've been our leads on the leadership series, and Gayle, thank you, and Naomi Billups for our food systems. And a real shout out to Angelo Bellamo from Los Angeles. He's really been just our thought leader on the environmental health track. And as we started launching that, we actually created a small working group. And I'd like to thank all of the folks, including Larry. Thank you, Larry. Corwin Porter, Heather Forshee, Nelson Kerr, who've been on our advisory committee. Thank you as we've gone along. And I'd also just like to thank my internal team here, to Katie Maiman, who's been our lead coordinator. I think you've done a great job in opening our eyes to the world of water. And everyone else on our team, from Holly Calhoun and Grace and Carla. So with that, I'd just like to thank all of you for participating on the call and wishing you and your families a wonderful holiday season. Thank you.